During this lecture, we're going to go over the muscles of the trunk and the arms. In the last lecture, we went over the muscles of the face and the neck. Now, when we think about the trunk, we're talking about the thoracic, the abdominal, pelvic cavities. We have quite a few muscles in our thoracic cavity, and they help in expansion and contraction of the thoracic cavity itself. And those muscles are assisting with the process of breathing, which is inhalation and exhalation. The major muscle, and this muscle that it also separates the thoracic and the abdominal pelvic cavities, is the diaphragm. So the diaphragm is a transverse muscle. It is this one right here. So it's located in a transverse orientation, kind of at the junction between the body of the sternum and the xiphoid process of the sternum. And it is a dome-shaped muscle. Kind of looks like a parachute when it's in its relaxed state. So right now what you see is the diaphragm shaped like a parachute. Now when the diaphragm contracts, it becomes flat. So a contracted diaphragm is not shaped like a parachute. Instead, it is flat. So when the diaphragm flattens out, the thoracic cavity has more room for the lungs to expand. So the diaphragm, in a nutshell, is a dome-shaped muscle that is located at the junction of the body of the sternum and the xiphoid process. In its relaxed state, it is shaped like a dome. When it contracts, it becomes flat. Therefore, the space in the thoracic cavity increases and there's room for the oxygen to fill the lungs. Now, the next set of muscles that assist with breathing are the muscles that pull your ribs outwards. So your ribs have to be pulled outwards in order to make room for your lungs that are going to expand during breathing. So these two muscles are the internal and external intercostals. Costal has to do with ribs, and intercostals mean between ribs. So these are the muscles that are located between your ribs, and they help with the expansion and contraction of the thoracic cavity by pulling the ribs outwards. The external intercostals are the more superficial muscles, right here, and the internal intercostals are the deeper of the two muscles. So the external intercostals pull the rib cage outward. So they're pulling the ribs outward to make room for the oxygen in your thoracic cavity. The internal intercostals are pulling the rib cage downward during exhalation. So when you inhale, the ribs have to be pulled outwards. When you exhale, the ribs have to be pulled downwards and inward. So that is what the internal and external intercostals are doing. So please keep in mind that the right side of the image is the superficial view and the left is the deep view. So external intercostals are more superficial, whereas internal intercostals are deeper. Moving on to the superficial muscles of the abdominal wall. Now, the abdominal wall muscles help with a lot of stuff. They help with breathing, respiration, inhalation and exhalation. They help during childbirth. They help with digestion, urination. So these are your core muscles of the abdominal wall. Now, what you're looking at in this image is a transverse section, superior view of the abdominal wall. Now, right in the center, right along the median, you have a sheet or an indentation, if you will, of connective tissue. And this indentation extends from the xiphoid process of your sternum all the way down to the pubic symphysis. So it's an indent. It's a physical indent that is made up of connective tissue, and that is called the linea alba. So the linea alba is made up of connective tissue or fascia, and it extends all the way from the xiphoid process of the sternum to the pubic symphysis. Now on either side of the linea alba, we have rectus muscles. We have 4 pairs of them, so 4 rectus abdominis muscles on either side of the linea alba. Now they're called rectus muscles because they are parallel to the median. So any muscle that's parallel to the median is referred to as a rectus muscle. So abdominis for the abdominal region. So what you're seeing here, this one and this one, are the rectus abdominis muscles. You have 4 rectus abdominis muscles on either side of the linea alba. So in total, we have 8 rectus abdominis muscles. Now to the lateral side of each rectus abdominis, we have 3 sets of muscles. So these are those 3 sets of muscles right here, located on either side of the rectus abdominis. So right kind of in your lateral lumbar, lateral abdominal region. Now the 3 muscles from the most superficial to the deepest. The most superficial one is the external oblique. The middle one is the internal oblique. And the deepest one is the transverse abdominis. So look at the names of these muscles. External oblique. External for superficial. Oblique, meaning that it is neither parallel to the mid-sagittal plane, nor is it perpendicular to the mid-sagittal plane. So those are your obliques. The transverse abdominis, or the transversus abdominis, is located perpendicular to your midline. And it is the deepest muscle of the abdominal wall, right here. So to recap the muscles of the abdominal wall, right along the midline, you have a physical indentation of connective tissue called the linea alba. The linea alba extends from the xiphoid process of the sternum to the pubic symphysis and the pelvic girdle. On either side of the linea alba, we have the rectus abdominis muscles. And there are 4 rectus abdominis muscles on either side. Up to the lateral side of the rectus abdominis, we have 3 muscles that make the abdominal wall itself. The most superficial of the 3 is the external oblique, followed by the internal oblique, and then you have the transverse abdominis muscle. So these muscles help with stabilizing your core. So they're helping with digestion, they're helping with expansion and contraction of your abdominal cavity during inhalation and exhalation. They help with bowel control, control of your bladder, as well as childbirth. So right here is where you are looking at the linea alba. I'm going to draw a line right here. That's the linea alba. These are your rectus abdominis muscles. So, whoops, that is 1, 2, 3, 4. 4 on either side. Now, the left side is superficial. This is a deeper view right here. Now, on the superficial side, you will see this white stuff that is covering the rectus abdominis muscles. So that is called the rectus sheath. The rectus sheath is fascia and connective tissue that is superficially covering the rectus abdominis muscles. And what you see over here is the external obliques, followed by the internal obliques. And then you have the transverse abdominis muscle right there. So we talked about the internal obliques, we talked about the transversus abdominis. Now the obliques help extend the abdominal cavity anterior and upwards, and posterior and inwards. So this is a very nice diagram that shows you the superficial versus the deep view of all the abdominal wall muscles. So you see the rectus sheath that has been cut. You can see the rectus abdominis. Over here, the external oblique, which has been cut off. Then you see the internal obliques. And right here, towards the posterior side of the abdominal wall, you see the transversus abdominis muscle. Now the next set of muscles are in the pelvic region. muscles of the pelvic floor and the perineum. Now, these muscles are extremely important for bowel control, urinary control, also for childbirth. Now, these muscles basically hold in all of your visceral organs, so the pelvic floor muscles. The first muscle that we're going to look at is called the levator ani muscle, and it's made up of two submuscles. So what you're seeing here, so think of this as concentric circles. You see the rectum and the anus, and around that there is a circular muscle right here, which is the external anal sphincter. So the external anal sphincter is the gatekeeper, if you will. So it's controlling the bowels. The levator ani is the next concentric circle. So the levator ani muscle consists of two submuscles called the pubococcygeus, for pubis, of the hip bone and the coccyx, and the iliococcygeus muscle. So the pubococcygeus is more towards the external anal sphincter. The iliococcygeus is the outer concentric circle. Both of these muscles together form the levator ani. The next muscle outside, so the third concentric circle, is going to be the ischiococcygeus, or ischiococcygeal muscle. The name comes from the ischium of the hip bone and the coccyx. Now these muscles, the levator ani, levator is lift up, and the levator ani muscles, the pubococcygeus and the iliococcygeus, are supporting the viscera. So they're holding in your visceral organs and keeping them from prolapsing. The ischiococcygeus is assisting with that. It's also supporting the visceral organs as well as elevating that pelvic floor. So you see that in women that have had difficult childbirths or have had several children, that the pelvic floor muscles tend to become weak. So there are exercises that people can do to strengthen these pelvic floor muscles. And the most popular one to do this is the Kegel muscles. So we talked about the levator ani, we talked about the ischiococcygeus, and the external anal sphincter. So it is a muscle, it's a circular muscle that kind of gives you voluntary control of your bowel movements. So the next set of muscles we're going to go over is muscles of the upper extremity. So we're talking about muscles that help with movement of the shoulder, muscles that help you with flexion and extension of the elbow, as well as the wrist and the digits themselves. By the digits, I'm talking about your fingers. So with the shoulder, we have several movements that we can do. We can adduct, abduct, rotate, as well as flex and extend. So we're going to go over a lot of muscles that help us with the movements of the upper extremity itself. So let's first talk about movement of the shoulder and the arm. So right here what you're looking at is the deep view of the thoracic region. Now in the thoracic region, you have your shoulder blades, you have your clavicle on the anterior side, and here's the ball and socket joint which forms your shoulder. The first muscle that we're going to go over is the pectoralis minor muscle. Now in the pectoral region we have two muscles. We have a pectoralis major, which is more superficial, and we have a pectoralis minor, which is deeper and the smaller of the two. So this muscle right here is the pectoralis minor muscle. So what it does is that it connects the coracoid process. So I hope everybody remembers the coracoid process of the scapula, and it connects it to ribs 3, 4, and 5. And what it does is it helps depression of the shoulder blade or the scapula. The next muscle in this set is the serratus anterior muscle. So it's the serratus anterior, serratus meaning it kind of looks like it has a sawtooth edge, as you can see right here. The serratus anterior muscle is deeper to the pectoralis minor, and it connects the medial border of the scapula. So everybody recalls a medial border. So the scapula has a medial border and a lateral border. So what you're seeing here is the lateral border. So the other side is the medial border. So it connects the medial border of the shoulder blade to ribs 1 through 9. Right here. And it helps you abduct and depress and rotate the scapula. So abduction is movement away from the median, rotation and depression of the scapula. Now on the dorsal side, we have quite a few muscles that help us do that as well. Again, the left side over here is the superficial, the right side is the deeper muscle. So in the nuchal and the acromial region, you have a very large muscle right here. It is called the trapezius muscle. So the trapezius muscle is the most superficial muscle in the region, and it helps depress as well as rotate the scapula from the dorsal side of the body. Now, if you remove the trapezius muscle, you expose the muscles that are deeper. And towards the medial side, so right along your vertebral column, you have two muscles right here, 1 and 2. So these two muscles come under the rhomboid pair. The superior one is rhomboid minor, the inferior one is rhomboid major. So these two muscles also help with the movement of the shoulder and the arm. Now, a major muscle that is also deeper than the trapezius, is the levator scapulae muscle. So this guy right here, levator and scapulae. So it elevates the scapula. So all of these muscles that we looked at right now depressed the scapula. This muscle, levator scapulae, elevates or lifts up the shoulder blade or the scapula. And now its origin is the transverse processes of the first 4 cervical vertebrae. So if you recall the structure of the vertebrae, you had the spinous process and the transverse processes. So this muscle, the levator scapulae, originates from those transverse processes of the atlas, the axis, and the 3rd and the 4th cervical vertebrae. It inserts itself into the superior margin or the superior angle of the scapula, and it helps pull the scapula upwards. Now on the anterior side, we are going to look at some muscles as well. So we've already talked about the pectoralis minor muscle. Superficial to the pectoralis minor muscle, you have the pectoralis major muscle. It's a huge muscle, very easy to identify. Now this muscle originates from the clavicle, which is your shoulder blade, and the body of the sternum, right here, and the costal cartilage, right here. So it's a large muscle, and it's kind of circular. So it originates from the clavicle, the collarbone. It originates from the body of the sternum and the costal cartilage. It travels outwards and inserts itself into the greater tubercle on the humerus, as well as the intertubercular sulcus. So I hope everyone remembers the greater tubercle, the lesser tubercle, as well as that indent between the two tubercles, which is the intertubercular sulcus. And these are located on the proximal side of the humerus. And look at the job of this muscle. So 1, it flexes, meaning it reduces the angle of the joint. It adducts, meaning it helps you pull in towards your median, as well as rotate the shoulder. Now, its helper on the dorsal side is the latissimus dorsi muscle. Latissimus, it's a wide and a flat muscle. So this guy right here, it's a huge muscle. It originates from the thoracic and the lumbar vertebrae. So it originates from T7 all the way through L5. So T7 all the way through L5 goes on to the sacral crest and the iliac crest right here. So it originates from there, travels laterally, and inserts itself also into that indent between the tubercles in the humerus, which is the intertubercular sulcus. Now it also helps adduct, pull in your shoulder, extend and rotate the shoulder as well. So we talked about the latissimus dorsi right here. At this point you can identify the rhomboid minor, the rhomboid major muscle. Now the next set of muscles are deeper to the trapezius muscles as well. And this muscle covers the acromial region superficially, and it's triangular in shape. So this one right here. And that is called the deltoid muscle. Deltoid muscles are triangular muscles. Now this originates from that spine on the scapula, as well as the clavicle on the anterior side. So it originates from the front and back. Those are the two vertices of the triangle. And then it inserts itself on one point in the humerus that you guys should already know by this point. It is the deltoid tuberosity. It's kind of midway along the lateral side of the humerus. And it helps with the abduction and the flexion and extension of the arm. Now that was in the acromial region. Now in the axillary region, or the armpit region, we have a muscle right here, and that is called the coracobrachialis. The coracobrachialis helps with flexion. Flexion is decreasing the angle of a joint. Extension is increasing the angle of a joint. Now on the scapulae on the dorsal side, I hope everybody remembers the supraspinous fossa and the infraspinous fossa. Now on the infraspinous side, we have again a pair of muscles. They're called the teres minor and the teres major muscle. This one right here is the major, and it's on the inferior side. This one is the teres minor, which is on the superior side. So let's take a closer look at the scapula and the muscles surrounding the scapula. So on the dorsal side, on the supraspinous fossa, you have the supraspinatus muscle, which is one of the muscles that make up the rotator cuff. So they help you rotate your shoulder. So that right there where the X is the supraspinatus muscle. And this one in the infraspinous fossa is the infraspinatus muscle. And right along here is the teres minor. So the teres minor, so all of these muscles right here, the supraspinatus, the infraspinatus, as well as the teres minor, are involved in the rotator cuff. So they come under that rotator cuff category of muscles. So they help extension of the scapula from the posterior side or the dorsal side. Now from the anterior side, the muscle that is part of the rotator cuff is filling up the entire subscapular fossa, and it's called the subscapularis muscle. So that's the muscle that is present in that subscapular fossa. So these four muscles, the teres minor, the supraspinatus, the infraspinatus on the dorsal side, and the subscapularis on the ventral or the anterior side form the rotator cuff. Now moving on to the movement of the forearm. Now we're talking about the muscles in the brachial region. So everything from the shoulders to the elbow. So on the anterior side, so when we come to the arm, we're going to look at a category of muscles that are referred to as flexors, which help you flex the elbow, and we're going to look at extensors, which extend the elbow. So typically the flexors in standard anatomical position, typically the flexors are oriented towards the anterior or the ventral side. The extensors are located towards the dorsal side. So the one that you're looking at right here, so this muscle right here is called the biceps brachii muscle. Bicep because it has 2 points of origin, brachii because it is in the brachial region. So the biceps brachii, 1 point of origin is the coracoid process on the scapula. The other point of origin is that glenoid cavity also located on the scapula. It travels towards the elbow or the cubital region and inserts itself on the radial tuberosity right there. So the radial tuberosity is that little bump right underneath that head of the radius. And this is a flexor, meaning that it helps you decrease the angle of your elbow. Now, if you remove the biceps brachii muscle, right underneath the biceps brachii is a muscle called brachialis. So right here, it's not very clear because the biceps brachii is covering up that region, but right deeper. So biceps brachii is the most superficial one. If you remove that one, you have the brachialis muscle, and it also helps you with flexion of the elbow. Now on the dorsal side or the posterior side, you have the corresponding extensor. This one right here. And this one is called triceps brachii. So the triceps brachii is tricep because it has 3 points of origin. So it also originates from the glenoid cavity and the coracoid process and the humerus, and it inserts itself into the ulna, and specifically the olecranon portion of that ulna right there. And it helps extend your forearm as well as the elbow. So you have flexors, which is the biceps brachii and the brachialis, biceps brachii being the more superficial one, the brachialis being the deeper one. And then on the dorsal side, you have triceps brachii, which is the corresponding extensor of the arm. Now looking at the deeper muscles in this region, we've already talked about the brachialis muscle. So what you're seeing here is the view of the arm with the biceps brachii, the deltoid, the coracobrachialis being removed. So you're looking at the brachialis muscle. Now if you remove the brachialis muscle, there's a muscle that kind of runs over, so from the distal side of the humerus towards the side of the radius. So think about it, brachioradialis. So it originates from the distal side, lateral epicondyle or lateral condyle of the humerus, and inserts itself onto the lateral surface of the radius right here. So in standard anatomical position, the radius is the bone that is located or is oriented towards the thumb or digit 1. And it helps with flexion of the forearm. So this is brachioradialis. So if I was to draw a rough figure right here, here's where you'd have the deltoid, here's where you would have the coracobrachialis, here's where you'd have the biceps brachii, right underneath the biceps brachii you would have the brachialis, and originating from the distal end of the humerus, running along the radius, you have the brachioradialis. Now here are 2 muscles that help you pronate and supinate your arm. So pronation is the opposite of standard anatomical position. So stand in standard anatomical position and face your palmar surfaces towards the posterior side. That is pronation. Supination is bringing your arms back to standard anatomical position. So bringing them back so that the palmar surfaces are facing the anterior side. Now both of these muscles are deep muscles, and the first muscle that we're going to look at is the supinator muscle right here. So it originates from the lateral epicondyle of the humerus, and it inserts itself on the lateral surface of the radius, and it, just as the name suggests, it helps you supinate the arm. Now the pronator teres muscle, the supinator muscle is present on the posterior side. So think of the olecranon or the not the antecubital, sorry, the cubital, specifically the olecranon region. So it starts on the lateral epicondyle of the humerus, inserts itself into the lateral surface of the radius. Now flip back forward to the anterior side. You have the pronator teres muscle that helps you pronate the arm. Now it also begins on the humerus, or originates on the humerus, but unlike the supinator, this one originates from the medial epicondyle of the humerus, as well as the coronoid process of the ulna. So this is oriented kind of from the ulnar side back to the radial side right here. It also inserts itself into the lateral surface of the radius. So these two muscles are pronator teres as well as supinator. Now here are the fun muscles in the antebrachial region. Now this can seem a little overwhelming at first, but let's break it down one by one. First, let's do the flexors, which are located on the anterior side in standard anatomical position. Then we're going to do the extensors, which are located on the posterior side in standard anatomical position. So the first muscle, the first flexor we're going to look at is the Flexor Carpi radialis. So carpi refers to carpals, wrist, carpal region. So this is a muscle that helps you flex your wrist. So reduce the angle of the wrist. And it is this one right here. Flexor Carpi radialis. Now look at its origin. It begins from the medial epicondyle of the humerus, goes downwards all the way to metacarpals, which are your palm bones, 2 and 3. So this one and this one. That is where it inserts itself. And it helps you flex your wrist and your hand. Hence the name Flexor Carpi radialis. The next muscle is the Flexor Carpi ulnaris. And it's oriented towards the ulna. So just like the Flexor Carpi radialis, it also begins from the medial epicondyle of the humerus, right here. So this is the muscle right here. It begins from the medial epicondyle of the medial epicondyle of the humerus, and goes downwards and inserts itself into a few of your wrist bones, which are the hamate, the pisiform, and metacarpal, which is the palm bone number 5, right here, pinky. So that is the Flexor Carpi ulnaris. This helps flexion of the wrist as well as adduction of the hand. So bringing it towards the median, bringing the hand towards the median is adduction. So we looked at two muscles, the Flexor Carpi radialis and the Flexor Carpi ulnaris. Now these two, out of all the muscles in this region, these two are the superficial ones. Now if you were to remove the Flexor Carpi radialis and the Flexor Carpi ulnaris, you look at the muscles that are underneath them. And that is when you come to the palmaris longus muscle, which is located, if you look carefully, it is right here. So it's in between and underneath the Flexor Carpi radialis and the Flexor Carpi ulnaris. And it helps again with the flexion of the wrist. So that is the palmaris longus. So you have the Flexor Carpi radialis, Flexor Carpi ulnaris. Remove them, you get to the palmaris longus muscle. Remove the palmaris longus, and you get to a large muscle right here. So all of this right here. That is called the Flexor digitorum superficialis. So Flexor digitorum helps you flex the phalanges. So bringing your phalanges, making a fist. Kind of, that's the movement it helps you with. Now this muscle originates again from the medial epicondyle of the humerus. So the one thing that all the flexors have in common is that they begin or originate in the medial epicondyle of the humerus. Now this one, the Flexor digitorum, inserts itself into the middle phalanges. So we have the proximal phalanges, middle phalanges, and distal phalanges on all of the digits except the thumb, where we only have proximal and distal. So it inserts itself into the middle phalanges, and it helps you flex or flex your wrist, or reduce, or not the wrist, but the fingers. So the next set of muscles that we're going to move on to are the extensor muscles. So in standard anatomical position, these are muscles on the posterior or the dorsal side of the arm. Now we have the Flexor Carpi radialis. We have its corresponding extensor, which is Extensor Carpi radialis. Now take a look at where it originates. The Extensor Carpi radialis muscle, and it is this one right here. Extensor Carpi radialis. It originates from kind of the lateral condyles. There's a little ridge called the supracondylar ridge. It originates from the lateral condyle side of the humerus and goes downwards, inserts itself into metacarpal 2, which is right here. And it extends and abducts. So the flexors help you flex and adduct. The extensor is helping you extend and abduct the hand. Now we have the Flexor Carpi ulnaris. Its corresponding extensor is the Extensor Carpi ulnaris muscle, and it is this one right here. That is the Extensor Carpi ulnaris. It extends as well as adducts the hand. Now these were the superficial muscles. Now if you remove those, you come to the extensor digitorum muscles. Now the extensor digitorum is right over here. So this is the extensor digitorum muscle. It originates from the lateral epicondyle. So all the extensors have in common that they originate from the side of the lateral condyle of the humerus. The flexors originated from the medial condyles of the humerus. And so it originates from the lateral epicondyle of the humerus, and it inserts itself into the distal and the middle phalanges. So distal phalanges are the tips of your fingers. Middle phalanges are the ones in the middle right here. And it helps you extend your phalanges or finger bones.